Nice question. And still I am working in MGM Medical College and learning new things. So I think only this is sufficient to give you a message that it is a lifelong learning which is essential for all the doctors. When we were teachers in initial phases, we used to use the blackboard and chalk. So since the method of teaching, everything has changed and is always changing, because change is the only constant thing in the world. After this, we were using overhead projector and then PowerPoint, and now we are using the YouTube material. And apart from this, the students themselves are using self-learning, self-motivated learning is also there. So the teacher has to be updated to teach such intelligent students nowadays.
Because as you know, whatever you learn today is going to be old knowledge or absolute by tomorrow. Like in electronics, by the time you purchase a mobile phone, a new model comes into play. So when we are, as a doctors or as healthcare professionals, we are dealing with life of the patients. Okay, so we have to keep our knowledge up to date so that we can give justice to the treatment of patients, as well as we can really give them benefit of the technology or the newer modalities which has come up, so that the patient, at the end of the day, we have to keep the benefit of patient in our mind. So if I did my MBBS 25 years back, and if I read my books 25 years back and I continue to treat the patient with the knowledge, limited knowledge which I have gained during my studies, and so patient doesn't know, because if they had knowledge about diseases and all, they would not come to us. Okay, so idea of the patient to coming or visiting a doctor is to get best of the things which are available. So it is my duty to keep my knowledge updated and treat the patient accordingly.
Regarding the treatment part, the drugs which we were using previously, the side effects may be known after use for a certain period, and after that, instead of that drug, we have to use new drug. So every time we have to learn about that new drug and what are the alternatives which are there that will not only help the patients but also investigating the newer drugs. So in such situation, the challenges are also always there, because all of you must have faced the COVID-19 situation. The pandemic was there only in books when we were students, and actually we have faced how the disaster is there in the pandemic, and it was beyond our imagination.
So as a surgeon, few things which were there, few surgeries which were commonly done in my student days, they are no more in vogue now. So if you are aware, vagotomy was an operation which I think nobody has seen in last 10-15 years now, because with the development in medicine, proton pump inhibitors which are available now, so acidity problems, they have gone down, and the surgery for that is no more done. Similarly, DU perforations, which were very commonly seen in few years back, now you hardly get to see a DU perforation patient nowadays, because the PPI of the medicines are good. So similarly, many things they have changed over the time, and that is the very reason why everybody needs to be updated and needs to keep his knowledge absolutely latest and keep on learning things.
But fortunately, we found that initially we were not knowing which drug is to be used for COVID-19, but later on we used even the Ayurvedic preparations and all these things, and by end of 2 years now we have come to the conclusion that no drug is effective. So this is how the knowledge and the information is changing. So unless you keep yourself updated, you can't stick to whatever you have learned 10 years back. Apart from the treatment, new modalities of the investigations are also coming. We were using only stethoscope previously. Now the days are there that whether we should use stethoscope, because USG and echocardiography is available. Even students are now doing USG and diagnosing that arrhythmia is there, cardiomyopathy is there. So unless we keep ourselves updated, it's not possible to diagnose diseases also. Apart from the diagnostic procedures, we have to keep ourselves updated with the material which is coming up on the YouTube regarding like journals and everything. Daily the information is poured in the computers, and it's not possible to know even what is going on in our specialty. Leave apart the specialties which are related with you. So it's very difficult to keep with pace with the demand. So unless we attend the conferences and continuing medical education, it's not possible to survive. If we don't update ourselves, the litigations will be more, and we have to face the litigations, and also the patients will show you your proper place. So be careful and keep updated yourself.
As a medical professional, every day many new things are coming in, and new techniques, refined techniques are coming in. So we can keep it. Best way of keeping it is that we can be well versed with our information technology, how it works, how the information comes on that. And only thing of faculty's role is to make you sure that which sites are authentic. So you can use it the best possible. And see that if you are best at information technology, two things can happen. One, on one side, that you will learn newer things earlier. Second thing, what you do something new, you can also present it faster. So the world will come to know very easily, and you can keep yourself at the top of the world. Yeah. See, basic thing is that on the net, if you go, there are different search engines. Like we talk about PubMed, we talk about Medline, and very commonly we use Google. So if you go on Google, you know that there is something called as Google Scholar. Usually their research articles will be there. Those articles you can follow. You can see, if you are interested, you can just type the name of that topic. You get information about that. What is recently occurring into that? One thing. Second thing is that there are something called e-books available on the net, which can be easily accessible. There will be something called it as the e-journals, which you can subscribe, or institute also subscribes for you, and you can keep a best at a click of a button. You don't have to run from this library to that library. This is how you can get. Another way is that small videos, small pictures, you can upload yourself also, or you can see from others also. You can even share among yourself on WhatsApp group, so that you go on updating your things. Or you feel that this topic is new, or this topic is recent, or you feel that something extra you want to know, you can just use that thing. So it is a very powerful tool. We should be able to use it effectively. Only thing is that you should always get authenticated those things from your faculty, so that you will be not landing into a trouble. And that is how, even in practice, even though new thing comes up, then you can always go for that. And one more thing what you can do, that is what is a very common thing, and because we can reach each other very fast. Like in Corona also, we talked about Zoom meetings. We talked about the Web of Science meetings or websites and all those things where you can interact online. So the thing has been developed in such a way we call as CMEs, Continuous Medical Education, and it has been expected that each doctor will attend at least 6 to 8 hours in his field, those CMEs where the expertise will be interacting with you. So even after 10 years, 15 years, something is advanced, something is gone new, you can always keep yourself trained. You can keep yourself knowing that what is happening now in the world. And you can also do a new techniques. You use new techniques. You can reduce, minimize the errors in your practice. That is very important. So that, and second thing is that definitely if you do the recent things, if you work with the recent things, definitely patient is going to come to you. Because he know this doctor is well versed with the newer things. He knows what is good, what is bad. And that is how we improve. And another thing is that presenting ourselves. If we have done some new technology, then we may go for conferences, present our ideas, our innovations there, so that others will also know easily, and that can be kept for everyone. Now this is how we can keep ourselves with the technology, and we have to understand that we are going to be a lifelong learners, and that is going to be because that will help us to maintain our career as well as a profession.
Okay. When I was at the age of 62 years, there was a letter from government that emergency medical services are to be started in all the medical colleges. So because I was in charge of the intensive care in Government Medical College Aurangabad, I knew that I have to start that emergency medicine, and for that I learned from the books which were of 6,000 pages, and I have to appear for 12 examinations, one exam every year, and unless we get 84% marks, it was not possible to clear the exam. And at the end of 1 year, we have to complete so many courses to get that certificate of the fellowship. For example, suturing, USG, then echocardiography. So also how to do the fundoscopy, because anesthesiologists are not concerned with this. We learned all these things apart from the basic life support and advanced life support in trauma, neonate, pediatric patients and adults, and all these certificates should be of the same year. So we completed all these courses in 1 year, and then at the end of that we completed our emergency medicine. And thanks to government, that because I was trained at that time, I could start emergency medicine department in MGM Medical College. The second challenge which I faced was skill lab. I didn't know this word when I retired from Government Medical College, and when I joined MGM, Dean asked me to look after the skill lab. So I came here and then saw all these dummies, except the dummy which is used for resuscitation. I didn't see any other dummy. So I have gone through the internet to find out what for these dummies are used and how that dummy is to be used, how to fill the water for intravenous demonstrating the IV line, how to give enema and all these things. So nearly 2 months I was struggling for that. Then I went to Bangalore and learned how to teach, how to use these dummies to the teachers. And then for 6 months I took one more training at the from the Tiruchirappalli. The training was from Amrita Institute, how the skill is to be imparted to the students, so how the lesson plans are to be prepared. And after the 6 months training, we had an online exam, and when we passed that exam, so then only we could teach all these things to the students. And today all our faculty is knowing how to teach the skill to the students, how to prepare lesson plans, how to make use of skill lab at the maximum. And I'm happy to share that in last 6 years we have trained more than 25,000 students and faculty, and they are using our skill lab optimally. And this year we had 40 more mannequins here, and at present we are having 120 mannequins in our skill lab. So it was really very challenging, because when we sent notice to the head of the department that please send the students for auscultating the heart sounds on the mannequin or murmurs, they used to say that all the procedures are done on the patient, why we want to use this one skill lab, unnecessarily waste the time. So then we have to emphasize them that this is to increase the safety of the patients. Instead of trying the skill first on the patient, we can get ourselves trained on the mannequins, and then the safety of the patient will be much more when they try the skill on the patient. So to convince the faculty as well as students was very challenging. But today I am happy to share that the students are approaching us that we want to learn this particular skill, and they are enjoying the skill lab posting more than the ward posting. So I think that is what we have achieved. Thank you.
Hi everyone. I really appreciate this project taken by our undergraduate students, and it's really very challenging that whatever advances are happening in the medical field, to cope up with all those advances and the challenges. There are challenges at technical front, at patient actual management front. So as a surgeon or physician, we really need to upgrade ourselves to meet all expectations from the patients, society, or from the policy makers. Being a practicing surgeon, especially as a surgeons, we have to not only update our knowledge, but we have to upgrade our skills also, which adds further demand on our part. To meet this demand is very challenging. And being a laparoscopic surgeon, again, it's a very demanding field now, and lots of advances are happening including some new procedures are added to the laparoscopic procedures. So we really have to not only learn, but we have to unlearn some old things and relearn some new things to fulfill this patient's demand. So what I feel, learning should not be a, like a one-time job that we have to attend some CME or we have to attend any conference and learn something. Learning has to be a continuous process. Whenever anything, any challenge or any difficult situation you face, you have to learn something out of it. Anytime, whenever you face problem, we have to find solution. We have to learn something out of it. And all these attending CMEs and all that, it's good to get which way to go or which way to what more can be done. So that punch you get in your conferences and CMEs. But to learn something, you should not wait for the conferences to attend. It should be a continuous process. And again, most of the time I feel life is too short to learn everything from your own mistakes. You have to learn something from your colleagues' mistake or from their own experiences. So that way, what I keep telling my resident also, if you are doing even dressings also, if you are better to done by tomorrow or today, if you have done it in a better way, what you have done it yesterday, then you are learning life. You are grown in life. This is how with small bits and actions, you have to keep growing every day in your life. And it can be anything, not only your professional skills or professional knowledge, it can be your social skill also. If you are able to convince your neighbors who was all the way fighting for you for nothing, and if you able to convince him and you could calm him down, you have grown in life. If you have done some charity work and you could able to help some needy people, you have grown in life. So you have to grow in every aspect of your life. It's not that only brilliant academicians or gold medalists, they do well in their profession or their life. It is the person who has grown in every aspect as a communicator, as a friend, as a socially responsible citizens, or as academicians. At every aspect, if you develop yourself, you will be successful in life, not only at academic skills or the surgical skills. So in this era of disruptive technology, whatever skill you achieve today to the best of best is capability or possibilities. Still, you will never know which skill will be outdated at what time. Because like I am telling you, like radiologist, in artificial intelligence, now there will be softwares which will give radiological reports 1,000 times more accurate than the humans. So it may be next not more than 5 years, even the radiologists will be absolute. We may not require a radiologist to give a report for any CT scan. Artificial intelligence, with the help of artificial intelligence, will able to give more accurate reporting. So we will not understand which profession or which skill will be absolute at what time of your career. So just don't bank everything on just one skill or one your subject. We must develop ourselves as a complete human with many skills. Like there are many games are there, video games are there, where your hero is loaded with many equipments and weapons. So as per time and demand, sometimes you will use just gun, or sometimes you will use some rocket launcher, or sometimes you will use some laser technology navigation system. Same way as a human, we will have to be upgrade ourselves, or we have to develop ourselves to such a skill level. You will never understand what skill will require at what stage of your life. So just don't bank on any single skill or profession or subject. Develop as a complete human. So wherever you will go, whatever comes to your way, you should be able to perform to the best of your capabilities and abilities. So with this, I am sure you will not be outdated any time in your career. And again, life is there to enjoy. It's not there to earn money or to earn fame and all that. So you must develop other skills also, like social skills, sports skills. All these are required if you really want to be happy and successful in life. So I wish every success for this activity and your future career. Thank you very much.